Constipation. Symptoms include infrequent bowel movements, hard, dry stools, difficulty or pain when defecating, and swelling of the abdomen. Regular exercise and a diet including plenty of fibre and fluids are vital for a healthy digestive system and should keep bowel movements regular. For the occasional times when the body may need some assistance, natural supplements can be gentle and effective remedies. Bowel habits can vary widely from person to person, but most doctors agree that anyone who passes hard stools and does so less than 3 times a week is constipated. If you frequently have to strain to defecate, you may also benefit from therapies aimed at relieving constipation. It's definitely not a good thing to be straining because that can actually damage the abdomen, the intestines, I think, or cause problems. So it's really not a good idea to do that. Um, in what causes it? In the majority of cases, constipation occurs because of a lack of fiber and fluids in the diet. Inadequate liver function is another important cause. Bile salts produced in the liver are natural laxatives and are essential for the proper functioning of the digestive system. Other factors include insufficient exercise or prolonged inactivity, severe depression and medical disorders such as high calcium levels, colon cancer, diabetes, irritable bowel syndrome, muscular spasm, or an underactive thyroid. Overuse of laxatives or some antacids can impair bowel activity, and certain medications, including drugs for high blood pressure, antidepressants, and narcotic pain relievers, can also cause constipation. Any abrupt change in the usual pattern of bowel movements may be a sign of a more serious underlying disorder, such as cancer or bowel obstruction, and requires medical evaluation. For occasional irregularity, various natural supplements may help. Benefits should be experienced within a day or two, with the exception of cascara sagrada. Wow. The following supplements can be taken on a long term basis if required. That includes psyllium, that's Psyllium, psyllium flaxseed, ground flaxseed, or ground fenugreek seeds provide fiber and make the stools larger. Oh, wow. I didn't know that. Right. So we'll have to get some fenugreek seeds, provide fiber, and make the stools larger, softer, and easier to pass. They can be used on a daily basis. Be sure to take plenty of water with them to facilitate the passage of extra bulk to the digestive tract. You can also try prune juice or dried prunes for extra fiber. These are gentle enough to use with the other supplements. Dandelion root tea has a stimulating effect on the liver, giving it mild laxative properties, and yellow dog tea, which acts gently on the bowel itself, is a useful alternative. Magnesium may help in cases of muscle spasms. If a combination of these remedies does not bring relief within a day or two, consider the herb Cascara sagrada as a last resort. This herb is a powerful laxative. It's spelled Cascara, Sagrada, Sagrada. It's a powerful laxative which stimulates the bowel muscles to contract and should be used for no longer than 1 or 2 weeks at a time. As a preventative strategy, remember that wheat bran is an excellent source of insoluble fiber which readily binds water to provide bulk. Bran is difficult to eat by itself, so try to eat bran-rich cereals every day and choose whole wheat bread rather than white or granary, neither of which contains much fiber. That was my experience when I was studying to be a student nurse, and I was eating sort of, processed white bread, which had no seeds or no hardly any fiber, and that was causing, I think, was causing my problem, adding to my irritable bowel syndrome. Um, so eat foods high in fiber, including raw fruits, vegetables, pulses, whole grains. Oranges, at least one a day, are particularly helpful as the citric acid they contain is a natural laxative. Oh, I didn't know that. Oh, wow, that's good to know. Um, However, oranges can cause problems if you have diarrhea, so that is an issue, so you have to consider that as well. With regards to pulses, Make sure that you're eating pulses and beans with spices, because a lot of pulses and beans are difficult to digest. So make sure you're adding fennel or fenugreek or cumin seeds to help digest that better. Drink at least 8 glasses of water or juice a day. Exercise regularly, and whenever possible, go to the lavatory as soon as the urge strikes. Do see your doctor if you notice an abrupt change in your bowel habits. If symptoms of constipation persist for 2 weeks or longer despite self care measures, or if persistent constipation is accompanied by unexplained weight loss, if fever or abdominal pain accompanies constipation, if cramping or pain is severe or disrupts your daily routine, if you notice blood in the stool, if the constipation develops into diarrhea or vomiting, if you have recently started taking a medication that may be causing constipation. If you have a medical condition, consult your doctor before taking supplements. So we'll go on to the supplement recommendation on the dosages in a few moments. So please take your pen and paper out. Recent findings: taking psyllium significantly increased the frequency of bowel movements in patients with constipation, according to a recent study from the University of Nebraska. Those consuming psyllium also reported that their stools were softer and easier to pass. Ah, well, that's also something that the Ayurvedic system is recommending. And what they recommend is that you take a teaspoon of psyllium husk in warm water before you go to bed, and take it with yogurt, because what happens with that is that the yogurt, the good bacteria, feed off the fiber in the psyllium husk overnight, and that cleanses your bowel overnight, which is fantastic. So try doing that as well. A recent study from Seattle found that men and women with frequent constipation were much more likely to develop colon cancer. The researchers concluded that the stools of those with constipation remain in the intestine for a relatively long period, thus exposing the bowel to potentially cancer causing chemicals for a longer period of time. The results offer another example of the potential benefits to constipation sufferers of a daily intake of psyllium or other natural supplements. Yes, and on that point, regards to colon cancer and things like that, I would say that a vegan diet would be fantastic. And try and obviously red meat would be a no, and you would have to eat more vegetables and fruit, I would think, and reducing your meat consumption should help. Facts and tips: if you are constipated, it is very important to drink plenty of fluids, but not all drinks are equally beneficial. Alcohol and caffeinated beverages actually cause fluid loss, making constipation worse. On the other hand, water, vegetable, and fruit juices and clear soups are excellent fluid replenishers. A hot drink in the morning may help to trigger the reflex that gets the bowels moving. Well, in the morning, I have copper water, and I soak it overnight, and then I have black currant tea. Um, and you can drink 2 cups of warm water first thing in the morning, before you exercise. Some people take protein powders first thing in the morning as well, which I do myself. Um, and in the evening, I would recommend for dinner just have a light soup, which will be easier to digest. For example, carrot and potato soups. You know, parsnip soup, carrot soup, anything that's easy to digest. So soup will be the best in the evening. But however, the to add to that, coconut water is another fantastic way of replenishing any fluids that were lost, and lime juice is also really good. So we're going to go on to the dosages, and the supplement recommendation, it says, is for psyllium husk is 1 to 3 tablespoons of powder a day dissolved in water or juice. Alternatively, take 1 to 3 tablespoons of ground flax seeds or 2 teaspoons of ground fenugreek seeds, whichever herb you choose. Drink 8 glasses of water a day. The 2 teaspoons of fenugreek seeds can be, you can just throw this fenugreek seeds into the pot and just fry them slightly in a little bit of oil straight away. That would be quite a good thing that we do as in Indian cooking. Prunes. Drink half a cup of prune juice or eat 3 or 4 prunes each morning. That's a lot. Can be taken on a daily basis. Dandelion root. 1 cup of tea 3 times a day. Oh wow. Use 1 teaspoon of dried powdered root per cup. Dandelion. You can get dandelion coffee and dandelion cereal drinks from the health food shops. So do try that as well. I've never heard of this one. Cascara sagrada. Sounds like sounds like a ship. 100 milligrams extract at bedtime. Avoid during pregnancy and breastfeeding. Standardized to contain 25% of hydroxytyrosine derivatives. Magnesium. 400 to 8 milligrams a day. Reduced dose if diarrhea develops. I was reading an article that a lot of people are deficient in magnesium, and so having higher doses of magnesium, and there is actually some magnesium that is easier to digest than others. Um, so yes, do look into those. And one last point I think I wanted to add was that in the Indian tradition, um, and even in the Muslim Pakistani tradition, people used to sit down on the floor cross-legged, and I feel that that actually helps the digestive process. Now that we're sitting on these sofas and these seats, the blood circulation isn't really moving probably to the area. Um, One moment, guys. I'll just answer this. I won't be a minute. Hello. And the other thing is squatting. So you can get a stool in your bathroom, and that helps a proper bowel movement. So sitting on the toilet isn't conducive to proper bowel movement. So by having a little stool raised up, that actually supports your bowel to have a proper full bowel movement. So that's something to consider. And then having a reflexology treatment, you can get these um, special slippers with reflexology points on them, and when you stand on them it gets the reflexology points going, stimulating. So first thing in the morning what I do is I walk around in my home um, with these reflexology slippers. That will actually stimulate the different energy points as well as your exercise routine. um, so that was it then. That was the only point I think that I wanted to raise. Okay, guys, thank you. Take care. See you.